The world is grappling with the largest outbreak of H5N1 bird flu ever recorded. Millions of birds have been culled globally to curb the spread of this deadly virus. This has disrupted supply chains and led to significant economic losses. Consumers face soaring prices for eggs and poultry products. Public health officials worry about the virus jumping to humans. The outbreak has spread rapidly across Asia, Europe, and North America. The current strain of H5N1 bird flu is a cause for concern, but it is important to remember that the risk to humans is still relatively low. Most cases of human infection have occurred in people who have had close contact with infected birds, such as poultry workers and those who live near live bird markets. The virus does not spread easily from person to person, and there is no evidence that it can be transmitted through properly cooked poultry or eggs. However, even though the risk to the general public is low, it is important to be aware of the symptoms of bird flu and to seek medical attention immediately if you experience them. Symptoms of bird flu in humans can include fever, cough, sore throat, muscle aches, and difficulty breathing. In severe cases, the virus can lead to pneumonia, respiratory failure, and even death. While the current strain of bird flu may not pose a significant threat to the general public, researchers are concerned about the potential for the virus to mutate. Mutations could make the virus more easily transmissible between humans, which could lead to a global pandemic. The possibility of the H5N1 virus mutating into a form that is easily transmissible between humans is a serious concern. Scientists around the world are closely monitoring the virus for any signs of mutation, and they are working to develop vaccines and antiviral drugs that could be used to control a future outbreak. One of the reasons why the H5N1 virus is so concerning is because it is constantly evolving. As the virus spreads from bird to bird, it has the opportunity to mutate and change its genetic makeup. Some of these mutations could make the virus more dangerous to humans. For example, a mutation could make the virus more efficient at infecting human cells, or it could make the virus more resistant to antiviral drugs. If the H5N1 virus were to mutate into a form that is easily transmissible between humans, it could have devastating consequences. A pandemic could lead to millions of deaths and cause widespread economic disruption. The outbreak of H5N1 bird flu is a stark reminder of the importance of global health security. We must remain vigilant in our efforts to prevent and control infectious diseases, both in animals and in humans. There are a number of things that we can do to protect ourselves and our communities from bird flu and other infectious diseases. First, it is important to practice good hygiene. This includes washing your hands frequently with soap and water, covering your mouth and nose when you cough or sneeze, and avoiding close contact with sick people. Second, it is important to be aware of the risks associated with traveling to areas where bird flu is circulating. If you're traveling to an affected area, be sure to avoid contact with birds and poultry, and make sure to cook poultry and eggs thoroughly before eating them. Third, it is important to stay informed about the latest developments in the bird flu outbreak. The World Health Organization and the Centers for Disease Control and Prevention provide up-to-date information on their websites. Finally, it is important to support efforts to develop a vaccine for bird flu. A vaccine would be the best way to protect people from this potentially deadly virus.